Hey everyone, I'm Dr. Josh Handt, and welcome back to the Human Powered Life podcast. This is the Chiropractic edition, and we have a mentor, a friend, an amazing chiropractor, Dr. Eric Plasker, with us today. So let me tell you a little bit about him. He is an internationally best-selling author of the 100-Year Lifestyle book series, an in-demand speaker and chiropractor, and he is on a mission. He wants to help us all live at 100% for 100 years or even more. He wants us to optimize our body's innate capabilities, see our longevity potential as a birthright time, not borrowed time, and develop a proactive mindset when it comes to creating our own 100-year lifestyle. Dr. Plasker has been practicing since 1985, do the math, people, and trained over 12,000 chiropractors with his methods. Recently, he was awarded the 2023 Life University Chiropractor of the Year. Everyone, Dr. Eric Plasker, welcome, my friend.
Thank you, my friend. So good to be with you, and so lucky to have great mentors in my life, like your family and your dad.
Yeah. Listen, it comes full circle.
It really
Full
does.
circle.
You're doing great work, reaching out to all these beautiful people. It's great to be with you.
Yeah. So just to give everybody, if this is your first episode or not your first episode in the Chiro edition here, we've devoured the internet, asked AI, got questions that the public wants to know about chiropractic. And I'm asking as many chiropractors that are willing to do so, but also I want to find the best chiropractors to do so. So that's why Dr. Eric Plasker is here with us. So Eric, we're going to dive right in. We're going to get to the first question. It's a tough one. It's really tough. What is chiropractic care?
Wow. That is a tough one, man. Well, for me, it's the only care, quite honestly. I mean, it's working with your body's nervous system to make sure that the brain and the body are communicating the way that it's supposed to be to every cell, tissue, and organ of the body. A lot of people don't realize that everything is controlled by your nervous system. If you want to wiggle your fingers, your nerves got to talk from your brain. If you want to wiggle your toes, if your heart's going to work properly, your lungs, your liver, your kidneys, your stomach, it won't work at all. If you cut the nerve, bam, you'd be done. If there's pressure on the nerve, it doesn't work near as well. But if the nerve supply is working properly, then you have the ability to function at your highest level, no matter what your age. And so to me, chiropractic is about being perfectly aligned, perfectly balanced, not treating symptoms, but optimizing your body's ability to function at its highest level for a lifetime.
Love it. Absolutely love it. So this is going to now shift us right into the second question, which should be an easy shift. What is a chiropractic adjustment?
That is a great question, especially as we look at chiropractic today as compared to what it was maybe 125 years ago, because there was one technique 125 years ago. And now there are so many different techniques. I call them styles, actually. When I talk to patients and the public, there are different styles of chiropractic. But the goal of every style is to remove the pressure from the nerve, to align the spine, take the pressure off the nerve so the body can function properly, so that the brain and the body can communicate with each other. Now, why do I say different styles and why does that matter? There are some people that if you come in and you have acute pain, there are very gentle techniques that can be used to make that happen. There are tonal techniques, we call them. There are soft tissue types of techniques. There are osseous techniques where you see all the crazy people on YouTube's doing all kinds of high intensity Showtime stuff.
Yeah.
And everything in between. And why is that important? Because people have different sensitivity levels. People have different levels of misalignment, subluxation. And there are some people that specialize in the upper neck, that they do atlas adjustments only. There are some people that specialize in full spine adjusting. And so what I think is important, especially today, and I don't know if this is going to lead to one of your other questions or not, but it used to be, you would hear people say, this is like dinosaur talk we're talking about, like in the dinosaur age. Oh yeah, I went to a chiropractor and it didn't really work for me. Well, here's the thing. Chiropractic always works. It really does. But sometimes different people need different styles. Sometimes a different chiropractor might do a style, softer adjustment, firmer adjustment, full spine, localized. That is what your body needs. So for me, I have a chiropractor that does full spine adjusting. I have a doctor of chiropractic that will, if I need a soft tissue type of adjustment, I'll get an activator adjustment. Sometimes if I'm really tight in my low back or I do crazy skiing like Josh over here, Dr. Josh, and I'm pounding down some moguls. You got to take it easy on me for the first adjustment or two coming back. But the point is, it's my primary care because there's not a day that goes by, a week that goes by that I want to make sure that I don't want to make sure that my nervous system is not communicating properly from my brain to my body
Mm,
and back again.
I love that. I love that. The
And let me just
different,
add one
yeah,
other thing onto
go.
that. So if chiropractic didn't work for you, or the chiropractor didn't work for you, or the style didn't work for you, your time with our industry is not over. As long as you have a spine and a nervous system, you should just find the right style
Mm,
that fits your needs.
yeah, right. The style, the personality, and in school when we're in chiropractic school, we call it the art form, right? Like some people, the medium is paint. Some people, the medium is a photograph. Some people, it's video, maybe a pencil. Same with, like you said, with chiropractic. There are so many different styles, art forms that resonate with everybody. And I myself have been adjusted since birth and have had full spine adjusting for most of my life. I'm sure when I was a baby it was very different, as we all know, adjusting children is very different than the big people like us, the big kids. But yeah, the art forms are powerful, and I love that you said find someone that resonates with you. It doesn't mean it's like if you had a bad dental experience because someone was really tough with, like, poking those things in your teeth and you hurt your gums, you're like, I'm done with dentistry. Never again. No, God, no,
Yeah.
nobody's doing that. They just go, new dentist.
Yeah. And
Yeah.
I joke around with people and they come to me and they have that attitude. And I'll say to them with love, I'll say, oh, so you're one of those prehistoric creatures.
Yeah, it's
And
it's true. I mean, we go to a bad mechanic, we go to a new mechanic. It's just we go to a bad restaurant, we don't stop eating in
yeah,
the
and
restaurant,
sometimes
right?
it may be a bad experience. Sometimes it's a style issue.
Oh,
That's what
100%,
makes it really
100%,
important.
100%. Yeah,
Yep. And do
if
you
you
know
go to
how
the
lucky you are to be adjusted since birth, being checked since birth? I mean, for me, I had to wait till I was 15 and had a broken back to go to a chiropractor.
yeah, yeah. We're gonna get into I think we're gonna start hitting some good questions for you. So, because of you can tell your little story here with what brought you in, but what conditions do chiropractors care for?
That is another very interesting question. In my world, the condition that we care for are vertebral subluxations. And now, if you said, what kind of conditions do the people that we take care of who have vertebral subluxations have? The answer is all across the board because we have people that come in with low back pain, disc problem, sciatic pain, foot drop, degenerative joint disease, DJD, which, by the way, I can't stand that name. I think it's the biggest misnomer on the planet. There's like 20 million people in the United States that have arthritis. Osteoarthritis is another name for it, but it's degenerative joint disease is what they call it, DJD. And the problem with that is that degeneration is not a disease. Degeneration is degeneration. And if it can degenerate, it can regenerate if you remove the cause of the degeneration. And so that's an example of one of the conditions. And sometimes people have it and they don't even know it until one day they do. But there are a lot of other conditions that people have. We have people with thyroid imbalances. We have people with heart palpitations, tachycardia, bradycardia. We have people with kidney problems. We have people with cancer. We don't treat their cancer. We look for the interference that there might be in the nervous system and we clear it out. And when we do that, the body responds. I'll tell you an amazing story. This just happened. We have a woman with a severe scoliosis. She called us up like 3 months ago and she said, she didn't call. Her husband called. She's 67 years old. When she was 17, she had a Harrington rod, like a 3-foot long rod, put in her back surgically to
Mm,
hopefully prevent her scoliosis from getting worse. Well, this woman has been living in hell for the last 60, whatever, 50 some odd years. It's terrible. And so she came in and she said, can you help me? And I said to her, honestly, I have no idea. I have no idea what to expect. I said, let's just evaluate you to see what's going on in your body. Let's see if there's any interference. And let's see, you got screws at the top and the bottom attaching this metal rod to your spinal bone, but there are no screws in the middle. So this is like a straight rod up and down, but the curve is like this big S curve.
Mm.
So I went and I said, well, let's just see what we got here. And I went down the spine on all the ones that were not attached to the bone. And I just started wiggling them. And there were a couple, we got a little, like little click, like just tiny, tiny little clicks. And after three visits of that, her lower cervical vertebra, her lower neck vertebra, which is not attached to any metal at all, the metal's not there at all. It's like 2 inches above where the metal ends. I adjusted her neck and it sounded like fireworks going off. It was unbelievable. She had blood, nerve supply just shoot up into her face like a light bulb went off. It blew me away. As Karen was sitting at the front desk and she like shocked, like, oh my God, what was that? And Dr. Cornett was doing some notes in the back and he heard it too. He's like, oh my God. And they don't all move like that. And she was like, wow, that was amazing. I needed that so bad. What can I expect from that? And you're going to love the answer. It's the same answer. I have no idea. I have no idea how that chronic nerve pressure was affecting your body. You know, the nerves that come out of that area, just as an example, they go to the upper shoulders, the trapezius. They go to the neck muscles, the intrinsic neck muscles. They go to the frontal neck muscles in the front of your neck. They go to your thyroid gland. They go to your upper border of your heart. They go to the upper border of the lungs. Cerebrospinal fluid that flows from your brain down to the base of your spine and back again. If it's misaligned like it was, that fluid can't flow to cleanse and nourish the spine and the brain. And so, you know, you say, well, what's being affected? I don't know. But I know that you're better today than you were right now than you were 5 minutes ago. And we're going to see what happens with that. But she was so excited because number one, we told her the truth. Like, how are you going to help me? You're going to treat this condition. And I said, no, we're not going to treat this condition. We're going to get to the spine. We're going to remove and clear out the interference from the spine and the nervous system. We're going to see what happens. You have all the findings. You have all the signs that it's affecting you. Let's find out how by taking the pressure off. And so for that reason, all those conditions I mentioned have responded to the care we provide, and sometimes they don't respond. But what always responds is the nervous system works better, the spine works better, and the patient's body and brain work better.
Yeah. I mean, it's pretty powerful. You know, talking about a surgery, you know, that was done, 50 whatever years ago. And, we've been under this almost like cloak of darkness that we just, if the surgical intervention, we do nothing. That's kind of we're done. And, for someone to experience chiropractic care that has had a surgery, and people may be thinking, wait, hold on, you can do this after surgery? The answer is yes. It's very specific. You need to know what you're looking at, right? As chiropractors.
Don't try this at home.
Yeah, exactly. But we're trained to look, right? Whether it's an X-ray or you have some kind of imaging that was given to you, whatever it is, we can work with what the person brings in, unless they are literally fused from their skull to their tailbone, glued, bolted together. There always is hope. There's always opportunity. And the term he used, subluxation, and then we use nerve interference. Those are, we're going to merge those together because that subluxation is a misalignment, right? That's what we were just saying. But that's what interferes with the nervous system. I just wanted to connect those dots to everybody, because when people go in and get the analysis done, like this woman did with Dr. Plasker, she didn't know what to expect. She's, looking for a solution. Her husband was clearly looking for a solution because it was impacting life. Not just discomfort, life.
Yeah. And it's important too. That doesn't mean we accept everybody as a patient or as a practice member, because what we do is we evaluate you to see if you have that interference. If you do, we'll take it on. And if you don't, then we'll refer you out because there's really nothing that we could do. And going back to what you were saying, like with the surgery, there are people that that I know of that they have been to chiropractors, but they didn't follow through. They did it their way. They did it like they were taking an aspirin instead of really looking to get more corrective with the spine and the function of the spine and the nervous system and all of that.
Hmm.
And so they maybe didn't get the result that they wanted. But then they later on, they find somebody else because they said, you know what, maybe I need to try it again. I mean, literally, I would try anything before I had surgery today. Anything.
Hmm.
What we've been seeing is unprecedented. In 39 years, we're seeing surgical wounds not closing because of the overuse of antibiotics. We're seeing people that had never been an addicted person ever go in for a simple surgery or procedure, whether it's in the mouth or a wrist or an ankle or something. They take an opioid once or twice and they get addicted. Nobody plans to be an addict. And so there are so many reasons to like make that last instead of first. And they got some really cool, we got Teflon, man. We got titanium. We could use titanium. And there's so many like cool words that they throw around. But the bottom line is that it should be, in my opinion, it should be a last resort. And you should try 4 different styles of chiropractic to find the one that's right for you before you ever had somebody cut on you.
Yeah, no, I think that's very powerful. And this leads perfectly into the next question. The number 4 question is this: what makes chiropractic inherently safe?
That is a great question. Josh, you should take credit for these questions.
That's that we could thank everybody that's listening, because this is what artificial intelligence did. This is what Google did right there. Just so everybody knows, they're listening and watching and recording what you type in when you're doing. So there may be some positives for all of the tech here, right?
Yeah, it's interesting. So the question with the artificial intelligence, and to answer your question, what makes chiropractic so safe is that the body has an innate intelligence. It's not being run by artificial intelligence.
Yes, it does.
So,
Yes, it
so
does.
literally chiropractors, and you probably know this already, you've probably covered this, but chiropractors have the lowest malpractice rates anywhere for the same amount of coverage that I have to have by law. Orthopedists, as an example, are 30 to 50 times higher. Obstetricians and gynecologists are 50 to 100 times higher.
Yeah, that's huge.
So you think about that. Why are the rates so low? And the answer is because it's really, 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 really rare to get hurt by a chiropractor. Really rare. And because we have an innate intelligence, or our bodies have an innate intelligence, we are trained to make sure that we don't override with too much force or or a force in the wrong place, to force ourselves on the body. We work with the body. We always say to a new patient, the first couple of visits, we want to see what your body's going to give us. We want to see what we can do. We want to see what we can get away with. We want to see what we can do, what we can't do. Let's see what your body can take. And then the problem with a lot of patients, I love you patients, people out there, but the problem is if you want relief now and your body's not ready to take the adjustment that it's going to take on visit 7 or 12 or 15, and you want it like, give me one and let's be one and done. Well, that's artificial intelligence at work there, if you ask me. That is not really a healthy way to go. And when you work with the body and you work with what the body will give you, it's amazing. And if you give it time and you work with what the body will give you, it's amazing the healing that can happen. And so we encourage our people. We tell them, and you, listen, you're 100-year lifestyle office. I mean, we love working with you on a daily basis. We're with you in spirit. You're with us in spirit all the time. There's the crisis care piece of it and the continuum that we have, the lifestyle care continuum. There's the crisis care, there's the critical transition, and there's lifestyle care. Well, the crisis care, the goal is relief and stability, and it's frequent visits close together typically. Why? Because we want to figure out what your body can take, be there, because we never know. Like, so this happened just this morning also. This person was like on visit 11, and he got good adjustments every time, little bits here and there. But today it was like the body sucked it in. And he said, well, that was amazing. Like, why didn't you do that the first time? Because the first 10 set you up for that.
Exactly.
The first 10 set you up for that one. And so today your body was ready. The only reason that one is because you were doing it as a part of the whole. And that's such an important concept and principle because healing does take time. And you don't want to create trauma to create healing. Sometimes there's trauma, usually not with chiropractic, but sometimes there is trauma but most of the time it's not. Most of the time it's working with the body so the body will accept the adjustment. I teach young chiropractors all the time and I said, you're applying the force, the body's accepting the adjustment. And so it's important for a patient to understand that your job is to be consistent, to show up and be consistent so that your body can get ready to accept the adjustment it needs because the body always wants to be right. It always wants to be right.
Yes, very, very true. And so then again, you're setting yourself up perfect for these questions. And everybody, I didn't give them these questions ahead of time.
Right there.
Right. So how does chiropractic care differ from other medical, I hate the word, but treatments?
Well, it's a completely different category. So I don't even know that they can be compared.
Mm,
We're not symptom treaters. We're not disease treaters. We see lots of symptoms and sicknesses and diseases change, oftentimes heal with the care we're providing, even though we don't treat them, but we're not symptom treaters. What I would say is that that's what makes us separate and unique. We work with the body's innate intelligence to get it functioning at a very high level. You know, we have an educational model in the 100-year lifestyle, like you mentioned, international bestselling. And I think one of the key premises of that is that health, longevity and healthy longevity, it's not living on borrowed time. It's birthright time. It was present from the moment of conception that you have an innate intelligence with all the blueprints to run your body the way it needs to be run and to function at a very high level as long as there's no interference to 80, 90, 100 years and beyond. And we're seeing that all over with assisted living centers popping up on every corner. These people that didn't know they were going to live this long and that have lived their life, they're on 8 medications, 12 medications. They've had one organ removed, then they had another organ removed. They've had one disease treated, and now they're on the medications of that disease, which are causing symptoms of another medication, you know, and so they end up with all these different medicines. As an example, we had a guy recently, and this is insane. This kind of makes me mad, but kind of plays to the foolishness of that concept and principle or concept and model. This guy came in with a condition known as new persistent daily headaches. That was his condition. Okay. So he didn't say it like that the first time. I said, so what brings you in? He said, well, I was just recently diagnosed with NPDH. I was like, NPDH? I had never heard of it. I said, NPDH, what's NPDH? He said, no persistent daily headaches. So I said, so what are you trying to say? That you all of a sudden never had it before, brand new, started getting headaches on a regular basis? He said, yes. So that's what you told the doctor when you went there? He said, yes. I said, and then the doctor told you had new persistent daily headaches, NPDH. So you went in telling him one thing, you left with the same exact thing with different words. He just told you the same thing that you told him with different words. So what did he do for your NPDH? He said he prescribed me some medicine. I said, okay, well, let me ask you a question. Are you on any other medicines, any other medications? And he said, yes. I said, how many? He said, 7. I said, okay. I said, can I get a list of those? He said, sure. So I got a list of them and I gave them to my assistant, Karen. I said, Karen, look these up, please, and look at the side effects of these medications, please. And so if you go to drugs.com, and you enter in whatever drug, whatever medication, it comes up, and then you'll see these side effects. And then if you you look for the professional, for the healthcare provider or the health professional, I forget the exact words, there's 2 separate sections for side effects. One is like just a list that the public sees, but then you could if you click a little bit here and there, you'll get side effects for the healthcare provider to see. And when you do that, you'll see every system listed. You'll see the nervous system, side effect, blah, blah, blah. Gastrointestinal system, side effects. Cardiovascular system, side effects. Elimination system, side effects. So they list the side effects by system for the healthcare provider. Not only that, when you go there, they'll say headaches, 10% of the time. Dizziness, 12% of the time. Tics, 2% of the time. And they list each side effects by the percentage, right? So this guy, who got diagnosed with NPDH, new persistent daily headaches. When we looked up his 7 medications and the side effects, which ones had the side effects were headaches, and then what was the percentage of time that they showed up as headaches, he had like a 270% chance of getting headaches as a result of every individual medication he was taking, adding all up the percentages. Like this medication was a 17%. This medication was 33% chance of headaches. This medication was 5%. You added them all up, he had like a 200+% chance of having headaches. That did not include the interaction of all of those drugs, which were never measured. So he got this condition, got another symptomatic treatment, another medication. Now he's got a box full, and that's the cause of his headaches. And now he's addicted, and his brain is all messed up. And I said to him, I said, listen, dude, you're going to have to be consistent, number one, to get this pressure off the nerve and to get it removed, because you have a long chronic condition here. But here's what's even more important. You're going to have to fight like hell to get your brain back. You're going to have to fight with all your might to get your brain back. And we'll see. So far, so good. But he's got a road ahead, because once it changes your brain, you got to realize, for any of you that might be on 2, 3, 4, 5 medications, there's actually a diagnosis for that and a condition for that called polypharmacy. It's a condition. So if you have polypharmacy, you're on more than one medication, get your butt to another chiropractor or the chiropractor that you're going to. Be consistent, step up your game, and get prepared to get your brain back.
Yeah. And also make sure you chat with the medical doctor so they can get you off those meds in a safe way.
Correct. Because that's outside our scope to be able to do that.
Yeah, of course.
I do that.
For sure.
And so what I did tell them was, you need to talk to your doctors about how do you wean off of this.
For sure.
And tell the doctor that prescribed you the 7th medication that you found the cause of your headaches. It's polypharmacy.
Yeah, the other ones, which is scary. I know they call them side effects, and it's when I talk to people in the practice, I said they're not side effects; they're just effects.
They're direct effects.
Are you tired of feeling stuck, low energy, stubborn weight, and endless fatigue? Team Make Wellness is here to help. Our bioactive precision peptides are backed by cutting-edge science to support your metabolism, boost energy, and improve muscle recovery. These peptides communicate with your body's innate wisdom to unlock better health and vitality. Stop settling and start thriving today. Visit lifestylelocker.com/peptides to learn more and take the first step towards your transformation. Once again, that's lifestylelocker.com/peptides. Now back to the show. Yeah, you take it. You wouldn't have the side effects if you didn't take it. So it's scary, but it's, we know this. I believe the only 2 countries in the world that allow people or businesses to advertise, pharmaceuticals to advertise on TV, or the US, and it's either, Australia, New Zealand, one of the 2.
Yeah,
New Zealand. Yeah.
And, I think the tide is turning, though. One thing that I love about what we're teaching with the 100-Year Lifestyle too is that we're the first generation in history that's getting the advance notice that whether we like it or not, want to or not, we're probably going to live longer than we ever thought, whether we like it or not. An article just came out that said we spend more years in sickness in the United States of America than any other country. And there was another article that said that people are living longer than ever, but they're not living healthier than ever. They're living sicker than ever. And that's not happening in most other countries. Why is it happening in the United States? Why is it happening in the countries that it's happening in? And the reason is because people are spending their whole life treating symptoms, never getting to the cause, not understanding how the body really functions. So the opportunity that we have, my good friend, my nephew, can I call you my nephew on live TV or live podcast land?
Yeah.
We go back such a long way. The exciting part of it for us as doctors of chiropractic is a lot of people don't realize out in the world that, in fact, I can't even believe that there are still people out there that still think that we're like not real doctors or that we're quacks or whatever, like the most ridiculous, again, for the prehistoric creatures out there that still think that way. But what a lot of people don't understand, I wrote an article that was published and it's gone global. It's called The Chiropractic Journey from Persecuted to Ascension. And We were persecuted for a long time. We're about to write another article, blockbuster article on it. The Flexner report that came out in 1910 that was financed by Rockefeller and Carnegie to basically squash anybody that wasn't quote unquote scientific, which meant that if you were scientific, you were using the byproducts of the oil that Rockefeller was making and distributing, putting the oil remnants in pills and distributing them. And it created a cancer industry. It created all kinds of problems. And it's basically, at this point, has been shown in court against many of the companies, several of the companies at least, almost like racketeering. And so, and we're seeing that more than ever. And we can talk about that more than ever. And I know there's a time and place. I'm not stupid. I'm not foolish. I'm actually smart and excited and passionate about the opportunity that we have now, that with Kennedy coming in, number one, with Make America Healthy Again, the agenda of that, and also the open your eyes and look on the street corner in every community in this country and in every industrialized nation, and you're going to see assisted living centers on every corner. Why? Because people had no idea they were going to live this long, so they had no idea how to take care of themselves to ensure quality life as they age. And we are getting this advance notice, my good friend. So we're living differently. The people that we know, our patients, our people, we have people that have been coming consistently for 7, 10, 20, 30 years plus, getting adjusted. Lifestyle care, we call it in that continuum. Lifestyle care, performance-based care. They made that transition from crisis care to lifestyle care. And when they do that, they almost never need to go to another provider because their bodies are just working really, really well. And if you did have to go, like we say, healthier going in, healthier coming out. If God forbid you had a crisis or a situation because you were healthier going in, you'll be healthier coming out. So, I mean, at 39 years in practice for me and, plenty for you, decades for you, right?
Yeah. 18 since 2006. Yeah.
This is an opportunity of a lifetime. We have been waiting, so many of us, not waiting, we've been working our asses.
Yeah.
We haven't been waiting. We've been working our asses off to get to as many people as possible to make a difference at a time where the world really needs us. And so I'm excited that now, because we are essential healthcare providers as appointed by the Department of Homeland Security during the pandemic ridiculousness, I like to call it. And so, here we are, we've made that transition. We are no longer considered in that box of, that the non-scientific. We are super scientific and we are super safe. And we work with the body's innate intelligence where the healing really comes from. So we are super effective creating results. You know what I love for patients? Here's the thing about my colleagues who I love. I love my colleagues, my brothers and sisters. Here's the kind of people that we are. We could see 100 people in a day and one doesn't respond. You know who we think about all night long? The one that didn't respond. In the years where chiropractors were fighting for licensure against the billions of dollars of propaganda that were being put out by the Flexner Report, the Carnegie Foundation, the Rockefeller Foundation, all that slander. The reason why chiropractic thrived and grew in spite of all of that is because it became a grassroots movement because of the level of results that people were getting. And because we were always fighting for survival, because we were fighting to stay out of jail because they were trying to throw us in jail. And so ridiculous. The slander and the propaganda was terrible. But now you look at it and you say, okay, well, why did we survive? It's because our people, we created a culture of results where leaders emerged, ground troop leaders with different techniques, Dr. Gonstead, Dr. BJ Palmer, Dr. Thompson, Dr. Stuckey, and so many other great leaders, Dr. Sweat, who created techniques, new techniques, activator technique, Arlen Fur, and just different types of techniques that emerged in the effort and the desire to get sick people well and keep the well from getting sick. And because of that, it is in our DNA to be exceptional at what we do and to be safe and to be effective. So I just think it's such an exciting time. 39 years, I wake up every day inspired. I go to bed tired every day. And so it's just a fun and exciting opportunity to work with people like the people who are listening to this podcast and their families.
Yeah. So true. So true. Then let's just jump into this because we're talking about the adjustments, the power, the amazing things that we get to see in our practices as a result of, I'll call it our forefathers in the profession. What can people expect during we'll call it a regular chiropractic visit, not necessarily coming in and getting the exam or an x-ray? What is a regular visit like?
It's a great question. And it's different in every office, I
Hmm.
think. I mean, there's a protocol. Every office has a protocol and every office has a foundation of technique. And so a lot of what happens depends on that. In our office, we take digital x-rays. We love taking them because number one, they're very safe, very low exposure. We can see right away. There's no chemicals. It's like a big fancy camera, phone camera. But we can see the alignment of your spine or the misalignment of your spine. We can see it right away. And we also do movement x-rays. And this is just in our practice. I mean, there are other people that they have EMGs, electromyographs, or other different types of scoping mechanisms or examination mechanisms, muscle testing. And you know what? They all work and they're all good. And so when you go, you'll get a referral. You can go to 100yearlifestyle.com if you want to and see if there's one of our 100 Year Lifestyle offices there that you want to try out. And if you're a doctor listening to this and you want to check us out and get listed there, give us a call, contact us. We're happy to interview you and see if we're a good fit. And so when you go to that particular office, you're going to have a protocol that's supportive of their way and their style and their techniques way of removing the interference and getting the nervous system functioning. So, like I said, so it's different for every office, different styles of finding it. And once we find it, then we have our own style of correcting it. Now, it's a very interesting concept because one of the things that I love about chiropractic is it's decentralized. It's decentralized. So the medical model is centralized healthcare. The guy on the 84th floor who's not a doctor, who looks at data, will tell the doctor who's seeing the patient what they can and can't do to that particular patient so that they can get coverage or reimbursement or whatever. That is a problem. That is a problem because it's taken away, in my opinion, it has taken away the clinical skills that are so necessary to treat each individual like an individual. So why is that important? To answer your question again a little bit differently is what you can expect is a protocol that's being used by a doctor to treat you like an individual so that they can find out what's there, remove that interference. But the centralized healthcare is what's made, in my opinion, the person on the 84th floor telling the doctors what they can and can't do. You can't do this much. You can't do this little. You got to do this. You got to stay in this lane. That person doesn't need it. Yes, he does. Yes, she does. No, not according to our records. So all of that, the centralization of big pharma running that show, political medicine running that show is a problem, in my opinion. Now, different in chiropractic. We are decentralized. We are like anti-centralization. Every doctor has their style and their technique, and they want to do their own thing in the way that is scientifically proven. There's standards related to all of those protocols. It's not like they're cowboys, and Indians. There are styles and protocols that they follow based on their styles. And most of them will say, you know what, this is not a good fit for my practice, but go see Dr. Jones down the street. Or, you know what, this is not a good fit for my practice, but go see Dr. Mary. She does a different technique, different style over there. Or, you know what, this is a perfect fit. We do that. We've referred people to upper cervical specialists. We've referred people to functional neurology specialists. We've referred people to pediatric specialists. Even though we do a great job with pediatrics, there are some of the kids that we see that, you know what, you need next level pediatric work here. And so fortunately, the way that chiropractic has grown up with all its technical masters who have been a part of our culture being created as a grassroots movement and having our research being done clinically over the years, there are so many different options that people have. So, it used to be that we would say as chiropractors, chiropractic first, drug second, surgery last. And I always like to joke around with chiropractors. I set them up in seminars. I say, do you agree with that statement? And every hand goes up in the room. And I speak in front of 2,000, 3,000, 5,000 people sometimes and doctors sometimes. And I said, well, I was teasing you. I set you up. I completely disagree with that statement. And they said, what? How could you disagree with that? because it should be chiropractic first, chiropractic second, different technique if necessary, chiropractic third, different technique if necessary, different ancillary procedures of support, nutritional, whatever, if necessary, and then surgery, then drugs, then surgery, fourth and fifth. And so this is how you keep your body safe. And listen, and don't ever let yourself be scared and fear mongered into making a decision that you're going to have to live with for the rest of your life. Do not allow that to happen to you. Take a few deep breaths, do some more research, talk to some different people. And this woman that I mentioned earlier at 17, she's 60 now. For the last 43 years, she has been living with the horrific consequences of that choice. And the only person that is going to live with the consequences of a bad, dangerous, highly invasive choice is you and your family.
Yeah.
And the degeneration all around it, it's so, and what's interesting is I always tell people with scoliosis, because there's like this whole thing with scoliosis now that they want to do this crazy surgery. It's coming back. There are trends and fads in medicine, and it's making a comeback. And I tell people all the time, they come in worried about this scoliosis, this sideward curvature of the spine. And sometimes it's really big, and sometimes it's just little ones that we see. And we say, listen, I'm in Georgia. If you drove from here to California, would it be a straight shot or would it be windy up and down and windy? Oh, it's windy up and down, of course, right? So the same is true with the spine. With the spine it's not that this perfect alignment of the bones. It's actually the holes of the bones where the nerves come out. Reggie Gold taught me that a long time ago. It's not necessarily the alignment of the bones, but it's the alignment of the holes in the bone. And so if it's like a train track or a road going, windy, as long as one segment of the track is not off, you're fine. But if that segment is off, what do you have to do for the train to be safe? Boom, you got to fix that piece of the track and you're fine. So it doesn't really matter whether there's a curve or not if you understand the reality of that. And that's why we say we work with the innate intelligence of the body, because sometimes our mind says we have to put it back exactly here, but the body will put it in a different way because the body knows, somebody that's 50 years old, they say, well, I want you to straighten my spine out. I say, look at these three bones here. They have been deteriorating on the right side. So it's literally much smaller on the right than it is on the left. So it's impossible to straighten that. If I straighten it out, you'd get sick. What's going to probably happen is it will just flow better. And it's like, oh, wow, it makes sense. And it should make sense. That's common sense. So many things we say, it's just too simple. We have to make it more complicated. What do you think, Josh?
No. No, not at all. Not at all. So let's do this. This is, we're talking about, kids, and we've talked about surgeries and all of the different pieces. The next question, which will start to lead into the next and the next, how many sessions will I need?
That's a great question. Here's the answer. I have no freaking idea. I don't. It's different for everybody, honestly. Now, there are certain patterns that we see, at least in my world. We have the way we break it down crisis care, critical transition, lifestyle care. So if you have a brand new subluxation, misalignment, pressure on the nerve with no degeneration, it'll take anywhere from 2, 3, 5, 7, 10 visits. I don't know. Something like that. If you have a chronic subluxation with moderate to severe degeneration, then you're going to need to be seen close together over probably a period of months. And that has nothing to do with us. It has everything to do with you. And so the goal in our world of the 100-year lifestyle, which we have a model that we teach our doctors, where the goal of crisis care is relief and stability. How do we know that you're becoming stable? Well, maybe if your doctor is adjusting 3 or 4 segments or 2 or 3 or 4 segments consistently over a period of time, close together, and then all of a sudden, all those segments don't need to be adjusted anymore. Just 1 or 2 need to be adjusted when you're coming close together. Then you're showing signs of stability. That's great. That's what we're looking for. That's how we know. And then we also can evaluate through, we take motion x-rays. We can start to see the motion changing in the spine. Then the critical transition this is really important. The critical transition piece of this is that you're already feeling better. Why do you feel better, by the way? It's because the inflammation is gone. The alignment has changed a little bit and the inflammation is gone. So you feel better. Once the inflammation is gone, the body is stabilizing. Once it's stable, then it can change. And if you stay consistent, regardless of how you feel, the body can change. I love that. Such common sense. So it's less frequent visits, but stretched out over a longer period of time, which is very, very exciting. So that's that critical transition piece. When we do that, we'll take post x-rays a year later and we'll see areas that were not moving in the neck, moving again. We'll see areas in the lower back on side bending films where they weren't bending and now they're bending. They're functioning normally again. And it's exciting. And so that's the critical transition piece. And then lifestyle care, that is a personal thing. And really, it doesn't depend on us. It depends on you. So lifestyle care, we tell people all the time that the intensity of your lifestyle care depends on the intensity of your lifestyle and how well you've done all along the way. I mean, if you're going to be like Dr. Joss over there and run 100-mile bike ride, swimming, climbing, whatever, you're going to need a lot more care than if you just hang out and meditate on a regular basis and eliminate all your stress. If your commute increases by 3 hours a week because your company moves or you're doing jobs in different places, you're probably going to need more care commuting 3 or 4 hours a week than you did if you're just, a 5-minute drive or a walk to work. So it's so much as common sense, and it depends on you and what your health goals are. And so, not to avoid the question, but it's really the truth. And then there's performance-based care. If you get to a point where, you say, I'm going to start training for a marathon. I want to keep up with my Dr. Josh Handt. Man, I'm going to be fit with powered. I'm going to train myself in this way. And so you step up your training. You know what? You increase the intensity of your lifestyle. You're going to need more lifestyle care. If you had a brand new baby and you're walking around with a 15, 20, then 30-pound weight, carrying it around all the time, you may need a little more lifestyle care, but it doesn't depend on us. It really depends on you and what your health goals are. But I'm going to tell you that if you do it that way and you follow that 100-year lifestyle chiropractic type of plan and protocol, you will almost never, ever, 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 ever need to go see any other kind of provider. And I'm not saying you shouldn't. I'm just saying you won't feel the need to do it.
Yeah. Yeah. And as a caveat, if you break a bone, don't come to us. Go to the ER for that part. We've had patients. We have a woman that this is during, I think it was maybe 21, 22, had a woman fly in. It was referred to us flying on her private jet from Florida, but she was referred to us. And I'm going, whoa, okay, that's pretty cool. And she came in. I've met her, talking for 10 minutes. And she goes, well, you're going to get me adjusted, right? I said, I don't know. Let's see what's going on. And we ended up x-raying her spine, doing the same kinds of motion films that you guys do. And she fractured her low back. And here, everybody, this was a fit mid-50s woman. If you looked at her, she looked fit. But she was doing Pilates. She felt a pop, hurt her back. So there's a reason we take x-rays. There's a reason we do the things we do, because we want the best for you. We don't want to just make you feel good. Of course, we want you to feel good. We're not jerks when it comes to wanting people to feel good and be happy, but we want to do what's right for you. So, to your point, yeah, there's a time and a place for emergency, but most of the time it's not an emergency.
Yeah, it's true. And I'm going to circle back to what you said about x-ray, that you take x-ray too, is, especially in the digital age, digital x-ray is amazing. We see so many malformations that you would never know unless you took an x-ray. We see bones that are fused together that people have been to other chiropractors that didn't take x-rays. And I'm not saying that everybody needs to take x-rays, but it's a good idea, in my opinion, to get an x-ray taken.
Yep.
And so this doctor was trying to move a bone that was fused because it felt really locked up. Well, it's not going to move. It's fused. There are other situations where bones grow differently, or they're shifted in alignment, or they've grown forward or backward. So it's really a good investment to see. And this just happened the other day. We had a guy a couple of months ago as a lead into this. He came in after a hip replacement surgery. So we took an X-ray, and turns out that now his right leg after the surgery is about 3/4 of an inch higher than his left leg.
Yeah. Very common.
And, and he looked at it and he says, "Oh my God, why is it that way?" And I said, "Because the metal rod is 3/4 of an inch too long." And I was like, wow. And so we see that a lot. Like you see that a
Yeah.
lot. So this happened the other day is that this guy came in and he said, I'm going to have a hip replacement surgery. I'm thinking about, all right, I think I'm going to do it. I said, really? So what's your timeline? 30 days. He said, do you think you can help me? I said, in 30 days, I have no idea how much we can help you with what you have. And he had degeneration in his hip. He did. I don't know that he was necessarily a candidate. In my opinion, I would have waited, but it's his body. So he said, what are you going to do? I said, well, you're either going to feel better and decide not to do it, or your spine and your hips and your pelvis are going to be aligned better. So if you do have the surgery, you'll do better in the surgery. And he was like, okay, that makes sense. And so he just came in to get a post X-ray because he decided he's going to do the surgery. And he was this guy is a different guy that I was mentioning earlier. This guy was about probably, I think, 5/8 of an inch off. Our digital X-ray can measure it. So he goes, and so he looks at it and he says, all right, so now, right as the post X-ray that we did after the care, it was level. He said, but I'm going to have the surgery. I said, well, at least we know that going into the surgery, this was level. And he was excited about that. You know what I'm saying? Because what did we say earlier? Healthier going in, healthier going out. Number one, he was level. I still didn't want him to do it, but it's his choice. I'm not going to, since he made the choice, he's going to live with that choice. We're going to be on it. We're going to champion him no matter what. Whatever his choice, we're going to champion him. That's also what I love about chiropractic. Whatever your choice, we're the kind of people that are there for you, no matter what the style or technique. That is just a culture of our profession, almost always all across the board. But now he said he's more confident going in. He wants to have it done. We'll see what happens. I have no idea what's going to happen, but we know that he was off and out of balance going in, or before he started care. We got him balanced out going into the surgery, and hopefully he'll come out balanced out, and it'll be a much easier, more positive experience for him.
For sure. I'm sure it will be. It's, the body's firing and wiring better. Why would he not?
Exactly.
Why would he not? All right. So then so I think this should hopefully be an obvious answer for everybody. When I ask a question, Dr. Plasker shouldn't have to do too much of an answer on this one. Are chiropractic adjustments painful?
No, mostly.
Yeah.
Here's what I will tell you is if it hurts when you get on the table, the adjustment may hurt a little bit only because it hurts when you got on the table. Okay. Now, some chiropractors will put ice on it. Some will use a softer tissue technique or whatever to make it hurt less. But it's actually like if you had a big rock on your foot, it would hurt. So you have that rock on your foot. That's how you come in. You're hurting. We take the rock off your foot. You say, thank you. That is 99% of chiropractic when you're hurting right there. Okay.
Yep.
Then the next piece of it is once you get past that and the inflammation is gone, you love it. Most people love to get adjusted. We have lifestyle care people that have been coming for years of all ages, shapes, and sizes. They just love getting adjusted. That's my favorite part. 39 years in practice. I couldn't be so passionate as passionate as I am now if I didn't see people for 5, 10, 15, 20, 30 years of evidence that they just love getting adjusted and how it's changed their life. And it continues to change their life because we used to talk about loud miracles and silent miracles.
Yeah.
The loud miracles were like, oh, I feel better. The silent miracle, that's these people I'm telling you about now. These are the people, they're the non-story. They're the human potential story because they
Yeah.
just they're living a good life. They're feeling good 90% of the time, 95% of the time. They're not afraid of getting sick. They're not afraid of germs. A new booger comes out on the market with a new booger shot, and they're not running to get it because they're not afraid. They're just trusting themselves and their bodies because they're living the experience of what it means to really be healthy.
Yeah. Yeah. And then this just goes fast forward right into the next question, can chiropractic care prevent future health issues? And I think you've probably answered that 6 times already, but do you need to add anything?
Yeah,
The
I have
silent
no idea
miracle.
how many of those things that we prevented along the way. I have no
Eh,
idea.
Yeah.
But I'll tell you, we have a woman, she came in she's been coming now for lifestyle care for probably 3 or 4 years. And she had been seeing a chiropractor for crisis care only. So
Hmm.
she adopted the principles of the 100-year lifestyle, the lifestyle care continuum, read our books and all that kind of stuff. She made it her number one choice. She just left us a review and she left us a message. She said, I used to get sick all the time since I've been doing chiropractic care this way and lifestyle care. I don't hardly ever get sick. I haven't had a cold in years. And we hear
Hmm.
that all the time. And my favorite part is they learn to trust themselves and they start to live without fear. There's so
Yeah.
much fear, unnecessary fear in this world. Dr. Josh, as you know, to see people have a light bulb go off and realize that they don't need to live with fear, that they can trust their body, the innate intelligence, man, and see how they raise their kids. And then they start raising their kids that way. Oh, you got a strong body, Johnny.
Mm.
Like, yeah. you know,
Yeah. Yeah. The
and
kids are great that
it's
way
just
for
like your
sure.
nephews, man.
Yeah. Exactly. Exactly. Well, then here we go. We take care of kids. I know you take care of kids and your own kids now that are having kids,
Yeah.
right? Yeah. Is chiropractic care suitable for children and pregnant women?
It is essential for pregnant women and children. It's it's really, I mean, when does the first subluxation or injury happen? It happens during the birth process very often with pulling and twisting on the neck or the spine or compression on the face or the skull or the shoulders or the body. The way that it's practiced very often, the birth process, drugs, etc., very hard on the mom and the baby. Cesarean section, same thing. It's not easier, it's worse, harder. And I'm not scaring you out of it. I mean, women who have one, they'll go have another baby. So the baby's worth it, obviously. But these are can be traumatic processes and traumatic events. And so we have pregnant women all the time who they can stand up straighter, they can sit again. It's reduces the pain during labor, reduces the time of labor to have a perfectly aligned pelvis and good nerve supply. If you're getting adjusted while you're pregnant, my wife was we have 3 kids. She was pregnant. While she was pregnant, she was getting adjusted on a regular basis. I'm sure that, I know, all your mom also and was getting it. And I know Morgan, same thing, getting adjusted, your sister. And my kids, brothers, family, same thing. It's just a way of living and it makes sense. And what's really interesting? I love, so I'm a 62-year-old man now. And I really like being 62 because there's wisdom here now. Almost 40 years in practice. We have never had to change our story. Do you know that, Josh? The
Yeah.
world keeps aligning behind our story. The BS, the bullcrap science that's been put out to sell people on procedures that are fads that come and go and they come and go and they come and go and here they go again. And we could recognize
Mm.
those fads when they show them. It's like, oh my God, they're going to spend $1 trillion on this fad. They're going to make $2 trillion. Lots of people are going to get sick. Some people are going to feel better. Some people are going to think it's a miracle, but there's so many people that are going to be harmed. And then they do it again. They pay off, a couple of $100 billion or $5 billion in damages. They made a lot of money, net profit, whatever it is, and they do it again and again and again with no regard for the people that are injured. They get cast aside. And I think that's what I also love about being a chiropractor is we don't ever have to cast anybody aside. You know what I mean? We don't ever have to
Hmm.
cast anybody aside. We understand the human body. We understand the human experience. We understand human potential and we understand what it takes to heal. And so, I think it's just an exciting time again. I don't even know what the question was anymore, but
This kid's
but
impregnant
I'm
with him.
having fun talking to you, my
Yeah.
nephew.
Yeah. No, this is so true. And, I want to wind down with this. We've covered a lot. We've hit, from pregnancy to our adjustments painful to, what is chiropractic all the way back in our first question. And, and I truly hope that those that are listening, for you that are listening, that you're inspired, that you're willing to look. If you're not yet seeing a chiropractor, start doing some investigation. Hopefully this series of podcasts will be insightful, will make you want to be more curious. So, you know what? This might be good for myself. This might be good for my kids. This might be good for my grandmother, everybody. And, with Dr. Plasker teaching the 100-year lifestyle, I will tell you personally, get the book. Just go to Amazon, go to his website, 100yearlifestyle.com, get the book. The stories in it are great. There are principles, there are action steps. That's the type of person I am. If someone shows me the information, shares stories of reality, and then offers, these are some simple steps to take. That's the way I love that. And that's how I practice the way I live, and I live the way I practice. So head over to the 100-year lifestyle, get the book, and start learning. And that being said, Dr. Plasker, Eric, I really appreciate your time here with us because, you've been a mentor of mine for many years, friend, family. I mean, it's kind of this big hodgepodge of everything in a
Yeah.
positive way. And I think it shows the power of family and community. When you're a chiropractic patient, you're treated the same way. Like it's like a big, big family. So I just have to say thank you for taking the time. I know you're busy with the business of the 100-year lifestyle, seeing patients, being a grandfather, all of the things. So I appreciate it.
My pleasure. And you know what? It's an honor to be with you. And again, you said all the things right back at you. Our families have been friends for a long time. I just traveled to Italy with your parents, Lisa and I with your parents. We went to Tuscany and Verona and had a great time. And, one thing, if you do go to 100yearlifestyle.com to get the book, that I want you to look at something new. We just came out with 2 new educational resources that are fantastic. One is a healthy longevity program. And the Healthy Longevity Program includes the book. It also includes this brand new guidebook, which a lot of our doctors and patients are using it for New Year's resolutions or to set goals or to just follow the plan. It's just a really great workbook to help you follow the plan. And it also comes with the audiobook that you can listen to when you're driving around. And it also comes with a digital resource page with links to like close to 100 resources to help you follow through and get to. So that is a fantastic, fantastic program. And if you put in 10 off, we'll know it's coming from Dr. Josh, where you came from, and you'll get 10% off if you do that. And so please go there for that. And then we also have a homeschool program now. So if you want your kids, we've had a lot of people reaching out to us, Josh, about, hey, you know what? I want to raise my kids this way. I got to get them out of this allopathic craziness. I need a total lifestyle approach. And the 100-year lifestyle homeschool curriculum or school curriculum is really fantastic. Right now, it's in Georgia, it's in Florida, it's in Iowa, it's in California. Individual families and small groups it's getting quite the little buzz out there. And so if you know anybody that's homeschooling, or if you just want a great family exercise to do together, check out the homeschool course. I think you'll really, really be inspired by it.
That's awesome. So everybody, Dr. Eric Plasker, and we'll leave you with this. You never know how far something you think, say, or do will impact the lives of millions tomorrow. They will. And Dr. Plasker, thank you again. Did you know that over 60% of Americans suffer from chronic health challenges like fatigue, weight gain, and metabolic issues? At Team Make Wellness, we understand that staying healthy feels harder than ever, but there's a better way. Our bioactive precision peptides are designed to enhance energy, reduce stress, and support fat loss, helping you feel better from the inside out. Imagine feeling energized, focused, and in control of your health. With Team Make Wellness, it's possible. Whether you're recovering from workouts, managing weight, or just want to feel better every day, our peptides deliver science-backed results you can trust. Take the first step to transforming your health today. Visit lifestylelocker.com/peptides to download your free guide and discover how peptides can unlock your best self. Once again, that's lifestylelocker.com/peptides.